I was a lucky dental technician because I worked in-house for most of my dentists, or I was going many times to deliver the restorations myself. So in many occasions, I was sitting in the corner watching the dentist talk to the patient. And I realized that there was a lot to be improved on this communication. And I realized that communication was something that I loved and that I wanted to explore, become better. And I started to help my partners, my dentists, to improve the strategy of communication. So when I saw this potential of helping my dentists to communicate better, to onboard better their patients, to influence patients' priority list, to impact people's behavior, to make dentistry a higher priority in the patient's life, to differentiate ourselves through this communication and make the patient choose us. When I saw the potential to develop strategies, systems, and know-how on this, I approached a dentist and I said, how much do you charge for a restoration? And let's say the dentist said $1,500. I say, okay. How much do I charge you for the ceramics? Let's say $500. Okay. So from now on, I'm not going to charge you $500 anymore. I'm going to charge you $1,000. And of course, when I said that, the dentist got really surprised. And he said, I really love you. I like you. You're my friend. You're my technician. But this is impossible. I cannot pay this amount. And then I said, but wait, I didn't finish the story. I'm going to raise my fee from $500 to $1,000, but I'm going to help you charge from the patient $3,000 instead of $1,500. Meaning that you're going to pay me more, but you're going to make even more per restoration. The answer from the dentist was, sounds great. I don't think it's possible. Good luck with that. My patients are already complaining about whatever I'm charging now. How can we double the fee? If you allow me, give me the chance, and I can try an appointment with one of your patients and see how it goes. So he said, okay, let's try. One day he called me, say, I have the patient. It's a new patient. Not sure if he wants to do the treatment with us. Maybe you can try this one. So I did my homework. We did the whole documentation, and I prepared a story. I prepared a presentation. I talked to the orthodontist. I talked to the periodontist. I, of course, relied on my own know-how of treatment planning. I talked to the main dentist, really developed a beautiful plan, but more than that, developed a beautiful story to explain why this plan was a life-changing plan. And I went to the appointment with my laptop, with my images, with my presentation, my slide presentation, my models, my mock-up, and I did what became the first and second DSD appointments that became a landmark for DSD. And I performed the process, and the patient said yes for the new fee. So, of course, I went back to the dentist and said, okay, now remember, you have to pay me double for my restorations. The patient is on board, and your new fee for this patient is double compared to what you used to charge. Long story short, after a few months, from one patient, it became 5 patients, then 10 patients, then 20 patients, and suddenly the new fee for that practice was this fee. My point here is that expensive or not expensive is a very subjective thing. It all depends on perceived value and emotional priorities. So if we are great clinicians and great technicians already, we have the right, we deserve the right to explore communication skills, storytelling, patient experience, to change people's priorities and to make people choose dentistry because we know that choice is the best for them, for the patient. And that's how the whole strategy of emotional dentistry started, and it became one of the main pillars of the DSD philosophy. First, we need to understand that patients don't buy dental treatments because the moment they do the check, the treatment didn't happen yet. So they're saying yes, and they're making the check for something that didn't even start yet, meaning that actually what they are buying is the experience that already happened before they even started the treatment. So for me, the first step is to acknowledge this, to understand the importance of the first and the second appointment. Something that usually dentists take for granted. Nobody really talks about the gold standard of first and second appointment. That's something that became a core topic for us. The other difference is that when dentists are talking to patients, explaining dentistry to patients, usually, even when patients are saying, yes, I understand, they're actually not understanding at all, or not understanding completely, or not understanding with their heart, not emotionally understanding, not engaging emotionally with the story that is being told. So we need to realize and acknowledge that traditional ways of explaining dentistry to patients don't work. We are very good as dentists, we are very good talking about dentistry to other dentists, but we don't learn how to talk about dentistry to patients. And that's something that we need to learn from scratch. Another topic, another thing that makes the whole process different is the fact that we need to acknowledge the fact that major decisions in life are emotionally driven. Even though we believe we are rational beings, we are much more emotional beings than rational beings. We like to believe we are rational. We like to believe that our decisions are driven by rational factors, but in fact, they are not. At the end of the day, we make important decisions following our heart, our sensations, and our emotions. And why this is important? It is vital because our competition is not the other dentist. Our competition are the priorities inside the patient's head. People say no because they have other priorities, not because they don't have the money. And priorities are organized inside our head based on emotions. Even though we think that we are prioritizing things because of rational reasons, we are actually prioritizing things because of emotional reasons. What it means that we need to understand how to make dentistry an emotional ultra priority. And that means that every time we are seeing a new patient, first, second appointment, we need to focus on gaining emotional credits and not rational credits. That is exactly the opposite what dentists usually do, because we believe that we need to rationally defend our treatment plan, that we need to rationally explain why we are the best, that we need to rationally explain the consequences of not doing the treatment. When in fact, I'm not saying we shouldn't do that at all, but what really moves the needle is explaining all these things from the emotional side, connecting from the emotional side. We need to make this new person sitting in front of us connect emotionally to the solution that we are offering. We need to make this new patient connect emotionally to the problem that they're facing. They need to emotionally connect to the consequences of not fixing that problem. And they need to emotionally connect with the possible beautiful future that they may have if they accept this treatment, if they accept this offering that we are giving to them. Dentists usually don't like to talk about selling dentistry. And I completely get it because I don't feel comfortable as well. Even though, pragmatically speaking, what we do as dentists when a patient accepts a treatment is selling. If you go to the dictionary, the meaning of selling is this transactional process of somebody giving money to the other in exchange for a product or a service. And we do that in dentistry. The problem is that dentistry is part of healthcare. And then in healthcare, things get blurry because different than any other business, it shouldn't be about the money, it should be about the patient. And many times a dentist needs to make decisions that are the best for the patient, that not necessarily is the best for the business or the best for the sales process. And we as dentists, we need to accept that and we need to be okay with that. It's not about our business, it's not about selling, it's not about the money, it's all about the patient. And that's why when I talk about a case acceptance, I always talk about ethical case acceptance, because it means we really believe that what we are offering is the best for the patient, even though many times the patient can't see it. So it's not a sales process, it's much more an educational process to allow the patient to own their decision. Ethical case acceptance is about, it's the opposite of persuasion. It's about ownership. It's about allowing the patient to own the answer of yes or no by making them understand as much as possible the impact of their decision in their lives into the future. And because of that, make patients understand that this treatment is probably something amazing for them and that they need to change their priorities and focus on this. So for us, ethical case acceptance means that the patient is at the center and we are always willing to make less money if that is the best for the patient. Ethical case acceptance also means that we acknowledge the fact that the better communicator we become, the more charismatic we become, the more persuasive we become, the more influential we become, the more responsible we become for the people we influence. So every little step towards becoming a better communicator means that ethically we need to raise our bar, raise our bar, raise our bar. Otherwise, we will do unethical dentistry. And we see that a lot. Dentists usually get very good at finding excuses and defending why they sold that treatment and why they did that treatment. And we can find all the excuses in the world, and this is not a problem for me to judge. What I know is that I'm always very aware of the influence that I have. And the better influencer I become, the more responsible I am for the things that I want to influence people on. So every time I'm presenting a treatment plan to somebody, I'm keeping that in mind, checking my ethical level and making sure that this is at the highest level possible. Another thing that I believe is important to mention is the fact that it is easier to sell the wrong dentistry than it is to sell the right dentistry. And this is why ethical case acceptance is also important. What do I mean with that? It's easier to fit the patient into our business model and convince the patient to do what is easier for us to make more money. And that's why we see specialized dental practices growing because it's easier to be specialized. So it's easier to do only aligners, or to do only veneers, or to do only all-in-4s. These are the DSOs that are usually growing faster, more simple to manage, less processes to control, fitting everything into that process, regardless if that is the best for the patient long term. That's what we do, and we are experts on convincing the patient that that's what they need. Doing the right dentistry, selling the right dentistry, making the patient accept the right dentistry sometimes is more difficult because it's not the easy choice. The problem in dentistry is that many times the easy choice is easier to say yes from the patient side and from the dentist side. The dentist makes more money with the easy choice, and the patient gets immediate satisfaction from the easy choice. But many times the easy choice is the worst for the patient long term. Selling long-term health is more difficult. Selling more comprehensive treatments now for better life into the future is more difficult, because many times it doesn't give you the immediate satisfaction of an easy one-shot procedure. That's why it's easier to sell 6 veneers than to sell 1 year of ortho plus 6 veneers. Even though 1 year of ortho plus 6 veneers will make your life much better in 20 years. People prefer to sell the 6 veneers without ortho. It's easier, cheaper, faster, and easier to sell. It's easier to sell full extraction, immediate all-in-4, smile on a day. Even though long-term is maybe better to preserve the teeth and have a longer treatment that will provide you with a much better life in 30 years, 40 years. Harder to sell, but much better if we understand the impact in our life. It's much harder to sell systemic health. It's much harder to sell dentistry that focus on systemic health. It's much harder to sell dentistry that takes airway in consideration. It's much easier to ignore that and sell the easy fix, immediate satisfaction. So that's why I always say it's easier to sell the wrong dentistry than it is to sell the right dentistry. And since we believe in the right dentistry, we want to master the process of onboarding patients into the right treatments. And the more comprehensive, the more ideal the treatment is, many times it becomes more difficult to sell. It means we need to become better communicators. We need to become better with case acceptance to do more of the right dentistry that we all love. So the better dentist we become, the more comprehensive we become, the more difficult it is to make patients see the value of that dentistry long term, the better communicators we need to become to convince these patients about something that is the best for them, even though they don't see it that easy. That is the reason why we, for the last 1 year, decided to focus on the process of ethical case acceptance and reinventing the DSD course after 15 years to launch a complete new course based on the principles of emotional dentistry, but empowered by all the new technologies and everything that we learned for 15 years about patient behavior, decision-making, communication, storytelling, changing priorities, and making people see and place dentistry where dentistry belongs. Unfortunately, we need to convince patients to be able to do the dentistry that we want. And I say unfortunately because when we go to dental school, we go to dental school because we want to learn how to do great dentistry. And then suddenly, afterwards, we realize that there's this little moment that needs to happen before we do dentistry, that is actually the patient saying yes to us. This moment of the patient saying yes is what brings every single coin that we make. Everything comes from that moment. It doesn't matter how good you are as a clinician. So, mastering this moment in an elegant way, in a subtle way, in an ethical way, is an art. And it doesn't matter if a dentist is already busy. Improving this moment is always amazing. It's a win-win. Ethical case acceptance is a win-win because it's the best for the patient, it's the best for the dentist, it's the best for the team, it's the best for the business, it's the best for the dentistry. Reinventing the way we onboard patients helps us reinvent the way we do dentistry for better. So it doesn't matter where you are in your career, stopping for a moment to challenge yourself and ask yourself, how good am I onboarding people and differentiating myself and making people choose me? How good are you making people choose you? There's no good enough on this topic. There's always room for improvement. If it's to do more of the dentistry that you love, if it's to get the credits you deserve from your community and your clientele, if it's to grow, to allow a better life for your staff and your team, or if it's to empower an associate, to allow your practice to generate revenue without depending on you 100%, if it's to start your new practice, if it's to start a second practice, if it's to standardize a process of generating new leads and converting these leads, it's impossible for a dentist, regardless of how much money you already make, to say that this topic is 100% under control. There's always room for improvement. And I strongly believe that very few people focused on this topic for so many years like we did, collecting the information that we collected, test driving these strategies with hundreds of clinics worldwide, learning, sharing, improving, mastering, curating, filtering, and bringing all the pieces together into a system that can be customized to the dentist style and take the dentist to the next level of his career. That's why I believe this course is for every dentist. What are the things that influence high-quality, ethical case acceptance? And these are the things that I was listing. What are the things that I need to master? What are the skills that I need to have? What are the components of successful ethical case acceptance? Of course, that the obvious one is clinical quality. Delivering clinical quality over and over again will generate word of mouth that will bring better leads that will already know why they are there because of your clinical quality, that will facilitate case acceptance. Marketing is also an obvious one. Branding, positioning, online presence, your website, your message. All of that together will make people come to you with a preconception of who you are. And if you did a good job with all of these things, a positive preconception that will help you on the process of generating case acceptance. But you also have reputation. Growing your reputation facilitates case acceptance. You also have charisma. Having great charisma is one of the main factors of case acceptance. That includes your behavior, your body language, your style, your communication strategies, the way people perceive you on that very in-person human moment. So the question and the content of this course will be around, okay, being a great clinician is important for case acceptance. How do you connect great clinical work to case acceptance? It's like a reverse engineering process, right? How do you take the fact that you deliver great clinical work, and what are the strategies that will allow you to use these skills to increase case acceptance? How do you translate marketing strategies into better case acceptance? How do you transform reputation and make reputation impact positively your case acceptance? How do you improve your charisma, your confidence, your communication skills, your presence in a way that it will impact your case acceptance? How do you transform your first and second appointment to potentialize the process of case acceptance? So basically that's the course, is to talk about things that everybody knows impact case acceptance, but nobody talks about how these things actually impact case acceptance. So for many years I've been thinking about these things and working on strategies and content that I believe will create this connection between the obvious things that we know impact, but now in a tangible way understanding how to implement these strategies to actually make the impact happen. I've been talking about the power of the first appointment for many years. I've been mentioning that for me, the revolution of modern dentistry happens on the first appointment. I've been teaching about the factors that transform a first appointment into this new ideal first appointment. And now with so many new technologies, the first appointment is being reinvented again. So understanding how to build this best possible first appointment for me is the number one goal of this course. Of course, we're going to talk about much more than that. We're going to talk about all the strategies to attract more of the right patients and all the strategies to convert for the right reasons. So I like to summarize the course as attract the right patients, convert for the right reasons. It happens before the first appointment and it happens after the first appointment, but the first appointment is the core. Is where most of the magic happens. Is where you set the tone, is where you start the connection, is where you understand the other human being. It's where you create your first impression and you never have a second chance to create a first impression. And it's amazing for me to realize how important the first appointment is to be a successful dentist and how little the effort we put on talking about the first appointment. Nobody really talks in depth about the first appointment. Nobody questions the first appointment. Nobody challenges the first appointment. We do the best we can, but every dentist that I talk to and I ask them, is your first appointment good? Of course, everybody says, yes, my first appointment is good. Can your first appointment be better? The answer is maybe, probably. I didn't really think that much because I'm so focused on delivering great dentistry that I never put the energy there. And that is the point. For us, the focus is 100% on the first appointment. So, of course, that in the course, not only are we going to share our vision of what is ideal from our perspective, but we're going to share different solutions and different technologies that the participants will be able to customize this first appointment to their style. It's very important to understand that case acceptance is something that is so unique and individualized and customized to the specific patient and the specific dentist. So it's a thing that happens between two human beings that are completely unique. So for me, case acceptance is something that cannot be replicated equally. It's not one fits all. It's something that needs to be reinvented for every new patient. Something that needs to be reinvented for every different dentist. So the goal of the course is to share strategies and share insights and help each one of the participants to first customize the suggestions to their own style, to become the best possible version of themselves as the master of the first appointment. And then share strategies to also customize to each patient. So for me, it's not like a formula that I can print into a little tutorial and give the same to everybody. It's a process of discovery. We believe that we can help the dentist discover their most powerful strategy for themselves and then help the dentist discover individually with each patient the best strategy for each interaction. Something that we're going to do in this course to make it more realistic and pragmatic is to bring guest speakers, clinicians that are running very successful practices and running very successful first appointments. People that are experts on sharing with others what they're doing, how they're doing. People that I profoundly admire. People that have been succeeding through amazing first appointments and amazing case acceptance. We're going to invite these speakers also because they are mastering specific technologies when doing that. And we want people to have a broad vision of different approaches and also understand the different tools that we want to use, and also see real stories, real success stories of the few dentists that actually focused on this magical moment and transformed their practice because of this.